I think that the experiences we have with STRAC is our experiences and processes that we've developed in the coordination of care and delivery of resources, and just managing the community. Testing was a huge one that the STRAC coordinated and helped us with. These lessons learned we're now sharing with other RACs. We share with the border RAC, we share with the RAC down in the valley to help them benefit from our lessons learned and what has benefited us having a coordinated, well-organized RAC. And it's crucial that you have that type of coordination. We saw where other RACs were having difficulties that we did not have because we have that open communication and coordination between healthcare systems. So we certainly are open about sharing that. I know we're sharing this with our colleagues in El Paso, and we're doing our best to assist them. And we are receiving patients today in a very organized and safe manner, even though that distance is tremendous, and it is just by nature a difficult transport. But it's being done in an organized and safe manner because of those things that we did here in San Antonio with our STRAC early on, and from lessons learned.
Would you say if we hadn't had this coordination with STRAC, would it look a lot different?
Yeah, I think it would have looked a lot different. Because you see this in other RACs in the state where it's not as organized and healthcare systems are not collaborative and coordinating and not looking for the pandemic to be an opportunity for some sort of one-upmanship. And I think it would have been much more difficult to make sure that our staff in the community, we are a large community, but we are in many respects a small community. Nurses work both healthcare systems often, many of them, and what we needed them to feel was safe as possible. And so having all the healthcare systems taking a coordinated and a same approach to how we were doing universal masking and PPE and recommendations. If CDC, and it was changing often, when CDC would change a guideline on use of N95s and what our supply was going to be on N95s, all healthcare systems, we talked about that in those calls every day and said, how can we make sure we're communicating this as one healthcare system of Bexar County so that all our staff feel as safe as possible? And I think that was remarkable. I think that other RACs and other areas and other states certainly did not benefit from that. Coordinating resources and just sharing information to tell them what our resources were on a day-to-day basis so that we would stay ahead of it. When we did get into an issue with ventilators, it was an issue of hours. It wasn't an issue of days or weeks, because as soon as we hit an issue where we were getting to the point to where we were running out, we were going to be in a difficult situation. Again, because we had that information shared early on, and we certainly were not the only healthcare system. All of the healthcare systems ran into a situation. We had the ventilators from the state with us within hours. I don't think that would have happened without the continuous communication.